I will keep on paying the aid because that will be two different changes. So we can only change one of the goals at a time. Remember, we are retraining the brain and we are retraining the bowel. Are you with me on that? So in order to retrain those two organs, it takes consistency, it takes hard work, but it can be done. It can be successful if we follow the goal to the T. And one of the things is you cannot change the goal, but only one thing at a time. You may wonder, for how long? Then what if I want to change because it's too expensive? Well, that's when the PT and other people decide, well, maybe 2 weeks before we make another change. I have seen 2 weeks, I have seen a month, I have seen a week. So the timing is up to them, but usually it's about 2 weeks before they make another change. Otherwise, the brain will not recognize and it will not get to the goal that we want. It's a pretty serious business, guys. It's a serious business. Have you guys seen the bowel program? Any of you? No? All right. When you guys did the rotation, you only see a few things, especially probably you see OT and PT and these things doing that. I don't know if you have the opportunity to see a bowel program, but then yet if you do, that's what you're going to expect. It's very, very rigid. They're very consistent, and sometimes they are successful, sometimes they're not. But the ideal is to stick to the goal, stick to all the components of that, and make the changes accordingly. All right, so right here, the first bullet talk about some principles, and the principles on slide 18, we will talk about that. But like I was saying, rehabilitation professionals can facilitate appropriate bowel management by following some simple principles. The principles we will talk about in slide 18. Constipation is one of the most common bowel problems. Yes, for some reason, constipation is, and that has to do with immobility, because if the person has a traumatic brain injury or they have a spinal cord injury, then they're going to be laying down, they only get turned, so immobility, pain medications can cause constipation. Sometimes the bowel, obviously the bowel does not function the way it's supposed to. The information of urgency and frequency does not reach the brain because the voluntary function is not there any longer. So constipation is usually one of the things that you can see in bowel programs, okay? So the only part that you will not see constipation, and I will write this down, is a patient with a PEG tube, because they're only getting liquids through it. So you will not see constipation. So if a patient had a PEG tube and obviously has an injury, you don't have to worry about constipation. It's not going to happen. However, if it's the opposite way, the patient had a stroke and cannot swallow, constipation will happen. Well, from the what was already in the body, and then they put a PEG tube. You may have a little bit of constipation at the beginning, but then as soon as it resolves, it's not going to be anymore. But keep in mind that constipation is one of the most common bowel problems among rehab patients. Okay?
What if the patient is utilizing both?
Say that again?
The patient is utilizing both. Like I had a patient who was feeding himself during the day, but at night they were supplementing through his tube.
He could have constipation. Yeah. It's only for those who uses only liquids.
Okay.
Yeah. Number 5. mechanisms of defecation. So we see here a word gastrocolic reflex. Do you know what the gastrocolic reflex is? Anybody? Gastrocolic reflex. Well, it's a normal response from the body in which the body feels like having a bowel movement. And that happens soon after eating. The gastrocolic reflex controls the motility and peristalsis in the stomach. But that's right after people eat. That's called the gastrocolic reflex. Now, what is again the voluntary control? Inhibits expulsion until suitable time. So voluntary control is when obviously you can hold it in to the time that you can reach to a bathroom. That's simple. Just a more fancy way to say it. So defecation is a complex process really, because it involves many muscles and many reflexes. It takes an effort to go, yes?
The gastrocolic reflex, is that triggered by like food or?
Correct.
So entering the stomach,
Mhm.
and that triggers the reflex?
Actually,
to say
you know
there's
when it
something in here?
starts triggering? When the person salivates. Like when they bring a nice smoothie and with a nice sandwich and the person is hungry, you kind of like go like that and begin to get a good bite, then the gastrocolic begin to move, to react in the body. As soon as the person eats, about within 5 to 15 minutes, I gotta go to the bathroom. So that's the result of that. That's the gastrocolic reflex. So again, it takes a lot of coordination to have a bowel movement, a lot of coordination of reflexes and muscles. Because also the muscles in the stomach begins to help with the movement of the bowel. So a person that has a system problem such as spinal cord injury or had a stroke is going to impede that voluntary control. And with that voluntary control, incontinence could happen, impaction can happen. Once that voluntary control is inhibited by that situation. And obviously that's what is called neurogenic bowel. And what was neurogenic bowel again? The loss of normal bowel control. Aren't you with me on that? It seems simple when we talk about it like this, but then yet you have to review it. Okay, just review it, how it works. Also, another important thing is the sphincters in that area. That they help to maintain control of the bowel as well. Those sphincters. And when the voluntary control stops, then those sphincters don't have the information to contract. They can't contract because that voluntary control doesn't exist anymore. So therefore they relax and the bowel movement comes out. Incontinence is the result of that for the sphincters. In addition to this, what is the function of the large intestine? To absorb water, right? The large intestines absorbs water. And to take advantage of the peristalsis in the body, there is peristalsis about 2 to 3 large peristalsis throughout the day. And when there is a bowel program, we want to take advantage of all those things. We take advantage of the gastrocolic reflex in the mornings or after eating. We talk about peristalsis when we listen to the vowel sounds. Sometimes they are more active than other times during the day. Sometimes when you hear it, like in the afternoon, it's kind of quiet, and it begins to act up toward the evening because it's dinner time. If you don't eat anything now until 12 noon, and then, oh, my stomach I just heard something. You say, oh, I need to eat something. So that's when the peristalsis is going. We have that like about 3 times during the day. So we have to take advantage of those things when we talk about bowel programs. It is simple. So did I say that the gastrocolic reflex happens usually 5 to 15 minutes after we eat? I want to make sure that I say that, right? Yeah. So it is important to take the patient to the bathroom in the morning after they eat 5 to 15 minutes to take advantage of that reflex to start the program going. We do it already with people who have pets, dogs. They eat, and you know, like 20 minutes for them, you're gonna take them for a walk because they need to go. That is the gastrocolic reflex. The same thing happens to humans, but in humans happens about 5 to 15 minutes after. And at that time, no matter what, every single day, the patient has to sit on a toilet or a bedside commode. Any questions so far? Are you good? All right. Then again, remember, do not, when we do the bowel, do not compare them. Just go with what it is. Okay. So, look at the bowel incontinence here. The rate of bowel incontinence is unknown. We don't know, of course. When we have incontinence, when the person has incontinence, is obviously the voluntary control is not there. All the bowel movement comes out, and with it, electrolytes come out. So, what happens when a patient loses the electrolytes? Arrhythmias will happen. Count on that. So, you're gonna have cardiac issues. So as nurses, we always have to be very vigilant about that. The patient says, oh, I just had diarrhea. Oh, okay, I need to put you on a monitor. So I know it's gonna be cardiac arrhythmias because they lose the potassium.